Alison Bigrigg was my wife. She founded Sandiford and was responsible for bringing family planning and sexual health together in Glasgow. Alison was passionate and committed. She believed in giving the highest quality of clinical service and focused on client satisfaction. She loved innovative thought being translated into practice. Therefore, we want to remember her in this legacy and reflect her approach in the awards that we make for improving sexual health in its broadest form. So, if you have an idea for delivering better clinical services and innovation is at the heart of your application, then we'd love to hear from you and perhaps to support your project. Please have a look at the following information on the ABLE Fund, and we look forward to receiving an application from you.
Sandiford offers specialised sexual health care, although it is recognised that sexual health, relationships and well-being extend far wider than what is offered in clinic. Sandiford was established in 2000 as the first fully integrated sexual health service in the UK, incorporating services for family planning and genitourinary medicine into one location. Over the years, this model has been rolled out to a number of community locations across Greater Glasgow and Clyde, known as Sandiford Hubs. And in 2015, the Scottish Government refreshed the Sexual Health and Bloodborne Virus Framework, which has 5 key outcomes.
The prevention of newly acquired bloodborne viruses, sexually transmitted infections and unintended pregnancies. A reduction in the health inequalities gap in sexual health. People affected by bloodborne viruses lead longer, healthier lives. Everyone in Scotland is able to exercise their right to fulfilling sexual relationships, free from coercion and harm. A society and culture where the attitudes of individuals, the public, professionals and the media in Scotland towards sexual health and bloodborne viruses are positive, non-stigmatising and supportive.
The ABLE Fund aims to build on Alison's legacy and is intended to support research and innovation that has a direct benefit for any area of sexual health. We aren't just interested in clinical services, but in the spirit of the framework, we want to support initiatives around sexual health in its widest sense. So, this could be the prevention of sexual ill health, promoting positive sexual health and relationships, developing more effective treatment and services, further education and learning, or an area of research. And importantly, it can be targeted at the public or fellow professionals. Here are some previous funding examples from 2 successful beneficiaries from the ABLE Fund.
My job involves seeing women and men with a very wide range of pelvic floor problems, affecting bladder, bowel, sexual function. Sometimes these difficulties and symptoms can be managed in a straightforward way, but I'd become aware that a different approach was required for some of the clients with more complex sexual dysfunctions. The Institute of Psychosexual Medicine offer a 2-year seminar-based training programme, but I was unable to get funding from my professional body who felt that this wasn't a sufficiently core training in physiotherapy. The ABLE Fund application enabled me to justify the relevance to my professional development and to demonstrate the benefit to women attending my clinic. I used the ABLE bursary to fully fund the 2-year training programme and was delighted to be in the first cohort of allied health professionals to be eligible to sit the diploma exam. I'm now in a position to help other physiotherapists who want to expand their skills in psychosexual work, and thanks to the ABLE Fund, gained the diploma and raised the profile of physiotherapists working with this group of clients.
I only actually became aware of the fund after I'd attended the graphic facilitation workshop, which was organised by the community engagement staff from Sandiford. I think they applied and got funding for it via the ABLE Fund. I work out in the community with people, and the workshops show me that using fun and different techniques are a great icebreaker really to get conversations started, especially around a topic such as sexual health. So I'm now thinking about what I could apply for this time round that would continue to help me think outside the box when it comes to working with a variety of different people.
So, who can apply? Well, it could be someone from specialised sexual health services or someone working in the very wide range of related services that have a positive effect on people's sexual health and well-being. You can work at any level, from junior administrator to senior clinician. Regardless of your current role, the Able Innovation Fund can help you make a contribution to sexual health, relationships and well-being with a little support. You have to work for NHSGGC though, and must have full support from your line manager to take your idea forward in terms of any impact on your substantive role. The maximum award available is £2,000, and the award must be fully committed and spent within 12 months. You must also agree to take part in the evaluation process of the fund. We are really keen to hear from you. If you have an innovative idea for a new project or service, or if there is a particular piece of good practice from elsewhere which you want to explore. It could be organising a conference or event, shadowing or visiting another service, not necessarily in sexual health, and bringing back what you learned into the workplace. It might be undertaking a piece of research, establishing a pilot project to test out an idea, or it could be something you have always wanted to do and have never had the resources. So how do you apply then? Well, in the first instance, call or email us if you would like an informal chat. Even if you don't usually think of applying for awards like this. Then fill in the application, which is available at www.sandiford.org/able-innovation-fund, and we'll take it from there. We will try to help you and make applying as straightforward as possible. Remember, it's not about who you are, it's about what you want to do.